Hello, 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 and hello again. You are welcome to this session where we learn, we teach ourselves about things of life, career, lifestyle, anything, everything. So it's time again for us to learn something new from our special guests. And today's topic is about sickle cell anemia. Sickle cell anemia disease. What is it about? Who does it affect? Is it common to, a certain set of people? Is it normal? Is it abnormal? Is it a disease like some people will ask? What are those how is it diagnosed? What are the traits? Is it genetic? Is it sporadic? It's so many questions. How many people have sickle cell in the world? What are the complications? What are the lifestyle of people who are affected by the disease? There's so many questions. But luckily today we have two guests. Two. This is the very first time we are having two people at a time on the show. And that's because we have a variety of people living in different parts of the world who are going to be sharing their experience of this condition. So, without further ado, thank you very much for those who have joined us online. Thank you so much. I can see you. You can't see me, but I can see you've joined in. Thank you, thank you, thank you. And this is a time for you to share, like, and subscribe and send to people who would need this information. Now, I have with me two guests. You've seen their names already, Abby and Obi. Wow, that rhymes. That rhymes, actually. I didn't realize that. Abby and Obi. So they're going to be sharing their life experience with us. And disclaimer, like is written over there, the speakers today are not doctors, but are people living with the condition, sharing their experiences with the world. So no information shared here is assumed as medical advice. Thank you very much. As you listen, just write your comments, write your questions, and let's do this together. We need to introduce our guest today. First on the screen, I'll introduce Abby and Obi. Thank you very much for coming here. Thank you.
Thank you for having me.
Thank you for having me, Bumi. It's a pleasure to be here.
Thank you. Thank you. So I'll start with Abby. Can you please introduce yourself? And then I go on to Obi to introduce herself as well.
Okay, my name is Abimbola Oluboyo. I like to be called Abby. I live with the condition sickle cell anemia disease. I work as an accountant. I am married with two children and married to a wonderful husband. What else? Yeah, and I also mentor, children with the condition and families that have children with the sickle cell anemia disease.
Wow. Thank you. Thank you very much. Obi, over to you. Sorry, I say Obi. It's you understand. Over to you.
Thank you, Bumi. My name is Obi Ageli Olubumi Davis. Everyone
Wow.
calls me Obi, so it's okay to call me Obi. Um, I'm a procurement specialist. That's my profession. In addition to that, I teach, I coach, I train. I'm a growth and development coach. That's what I like to describe myself as. I'm a mother to two kids. One of them is a sickle cell warrior, and that is why I am totally sold out to everything that has to do with the condition. So it's an honor to be here, and I'm looking forward to having a very rich conversation with you and Abby.
Thank you. Thank you very much. So, Abby, first question: what is sickle cell anemia, in your own words?
Okay, sickle cell anemia is a genetic disease, is inherited. For you to have sickle cell anemia disease, both parents must have the S genotype. So two S genotype combine to give, the condition. There are in some parts of the world, there's a C genotype also. So some people have the C instead of the S, but it has to be one S and another S, or one S and another C. There are various types of the diseases, various types, but we just call it generally sickle cell anemia disease.
Okay, thank you. All right, Obi, do you have any explanation to what exactly sickle cell anemia is?
Well, like Abby said, it's a genetic disease, um, and both parents, when either of the parents has the sickle gene in them, then there's a likelihood that one out of every four children they have might end up having the sickle cell condition. It's a blood condition that affects the bone marrow. Basically, what happens is that the red blood cells they tend to break down quicker. The red blood cells are supposed to be round, like a circle, normally. But what happens with people who have this condition is that when the red blood cells break down, they tend to form a C kind of shape that looks like a sickle. That's where the name the sickle is derived from. And those sickles can, come together and form a hook. And when that happens, it tends to clog some certain parts, where the blood is supposed to flow through.
Hmm.
And if that clogging occurs, oxygen is unable to flow freely in those parts where this clogging happens. And that is what is described as the crisis. And this sickling can occur in any organ of the body. And we all know when oxygen doesn't flow properly, what
Hmm.
happens? Oxygen is the flow of life. So when oxygen isn't flowing through a place properly, it can cause a lot of pain. Basically, that is what the sickle cell disease generally looks like on the surface. Um, and that pain is what Nigerians would describe as a crisis.
Yeah,
Hmm.
all over the world, it's called the pain crisis.
Wow. Thank you.
There you have it.
Well, it's so interesting. You call it a disease. Is it actually a disease, and why would you say it's a disease, Abby?
I don't have an answer for that. I'm not a medical person, but that's the way that's the way it's described, you know. And thank you very much, Obi. This is like about the first time I'm hearing somebody describe it so perfectly. I didn't want to describe it like that because I felt I'd be giving out too much information and I might just discourage some people, you know. I just wanted to keep it short. But yeah, thank you very much.
Yeah.
Abby, no apologies. I never keep it short when it comes to sickle. And the reason why I do not keep it short is because we need this awareness. If we don't explain this in layman's terms as we understand it, then it looks so big. So and so it's important for us to let's just call it what it is so that people can visualize what exactly this condition looks like.
Uh, Something else I would like to add,
Yeah.
sickle cell is common among people of African origin. The like we have said on this program, it is hereditary. It flows from both parents to the child. So yeah, it's common among people of African origin and it flows from, parents to children.
Okay. Wow. Thank you very much, Queen's Corner TV. Thank you very much for showing up on this channel. Thank you for joining us. Yes. Okay. So we've just defined what sickle cell is in a layman's language. And I was asking, I said, is it a disease, and why is it called a disease? But there's no answer to that yet.
Well,
What
sickle cell is a disease. As far as I'm concerned, I'm not a doctor. Again, the disclaimer is out there. It's a disease because it is a condition that alters the pattern of somebody's well-being generally.
Okay.
It's like asking, is cancer a disease?
Hmm.
Why is cancer a disease? It's capable of impairing the person's well-being. It's capable of damaging organs. It's capable of ultimately taking the person's life if it's not well managed. And
Wow.
so sickle cell is a disease.
Wow. I'm just checking now. I know we're going to make it as interactive as possible. I'm just checking online now to see what actually is a disease and why do we call it a disease. So Google tells me, of course, our usual go-to. Google tells me is a disorder. A disease is a disorder of structure or function in a human, animal, or plant, especially one that produces specific symptoms or that affects a specific location and is not simply a direct result of physical injury. Anyway, so that's grammar. It is a disease because it's a disorder, and of a structure, a structure of a human body. Okay, that says it all. That is why it's a disease. Okay, because I would usually think a disease is something that kills. When you say someone has a disease, you're like, oh, okay, next thing is death. But okay, so it's something that alters the structure. All right, thank you very much for throwing light on that. You are welcome. The word of God, garden, and more. God's blessings always. Thank you very much for joining in. And for the rest of the people online watching us, thank you for joining in. Remember to share this. The next question actually I have is, can we actually cut it? Well, no. How do patients get the disease? You've told us it's based on parents. If parents are affected, I've got the sickle cell in their own structure of their body, they end up passing it on to children. Is there a way sickle cell anemia disease might not be genetic? Is it possible?
No.
Sorry, I know you're not medical people. I'm just sorry.
No, it's not.
It's hereditary. It's hereditary.
So it has to be through parents.
Now, one of both parents must definitely have the sickle related genotype. That's AS. One of the parents must have the AS genotype. And the genotype is different from the blood group. They're two different things. There is the blood group and there is also the genotype. So it is when one of the parents has the S trait in their genotype, then the child has a likelihood of they have a likelihood of producing a child who has the sickle cell trait.
Yeah. Okay, great. So from what we can say now, Abby, how can we prevent or cure this? Because from the look of it, it seems okay. So before I know in some parts of the country, I don't know if it's a general thing, that before you actually go into marriage, you tend to check the genotype of the partners before they can actually get married. What do you think is the prevention or the cure? I know some people, that's the way they try to prevent it. Are there other ways of preventing or curing the sickle cell anemia?
Okay, thank you very much. Let me talk about cure first, then I'll go to prevention.
Okay.
For a long time, there was no cure, but technology, science and technology has given us a lot of breakthroughs. So the cure available now, they are still in their trying period, but it's I think it's stem cell. It has something to do with stem cell and bone marrow. Some of my mentees, two actually of my mentees, have done the transplant and they are successful. One is a toddler, like a 4-year-old. The other one is in middle school, what we call GSS in Nigeria. So the one in middle school did the transplant before the lockdown, just before the lockdown, and he's very healthy, but I don't think the cure is available in the United States where I live, so, and it's very new, very few people have gone through the transplant, and I know 2 success stories. So that is what I know. Now, prevention. The only way prior to now that we have the experimental, the cure in the trial period, the only way not to have sickle cell disease is by prevention, right? So, like we have mentioned before, that 2 people will have to carry at least one S genotype. Either one will carry one S, or in some parts of the world, it's a C. So some parts of the world, the S and a C, and some parts S and S. It depends on what part of the world you live in, but it's the same. It's sickle cell anemia disease. So at least both parents need to have one of those genotype, right? And when they have children, 1 out of every 4, there's a possibility, the likelihood is, because we have 2 genotypes, right? Like A, S, A, S. So that's 4, right? So there's a possibility that 1 out of every 4 of their children will have the sickle cell anemia disease. So the only way to prevent it is, number 1, education. And when I say education, this is what I mean. And this is what I did. I did it myself. When people want to start dating, some people will say, when you want to get married, go for the test and make sure you don't have sickle cell. By the time you want to get married, nothing is going to stop you. You're like a moving train. At that period, no matter what anybody says, you're going to get married, period. So for me, what I did and what I will encourage people to do before you start dating, before I said yes, I went, before I said yes, I'm going to date you, not yes, I'm going to marry you. Yes, I'm going to date you. We went to test our genotype. I was not kidding. I was not ready to have a child with the condition because I have the condition. I don't want to spread it. I don't want to bring somebody else to this world with the condition. So before your feelings start to develop towards that person, please go and get your genotype tested. My husband, of course, told me his genotype. I didn't believe him. I wanted to see it myself. Until I saw it, then I now started thinking, should I date him? Should I do this? Should I do that? Because I was determined that come rain, come shine, I'm not going to date anybody with S genotype. It's not going to work with me. So I think the only way to do it is before you move on in that relationship, don't wait till you have your wedding date, or don't wait till you started dating and it's 5 months, it's going to be difficult at that point. Thank you.
Can I add something quickly to what
please.
Abby just said? By all means, education. And let me hit the nail on the head and bring it home. The way to prevent sickle cell from occurring is not to marry somebody else who carries this gene. I wouldn't say marry. I would say do not copulate, do not make love, do not sleep with, do not have sex with somebody else who has the S trait. Do not put yourself in a position where both of you can sleep together and one of you is going to get pregnant. Because that pregnancy has a 25% chance of being a baby who has the sickle cell condition. I wanted to add to what Abby said, that while you're dating, go and test. Please do not just test. You're going to test one time, you will retest a second time, and you're going to have to retest a third time in different labs. Because my own story, I wasn't a moving train. I walked away from a marriage that was almost about to happen because I always knew my genotype. Well, here I am today. I have a child with a condition. I did test. I tested. Okay? But I did not retest. test.
Mm.
And from my own journey, I have seen and learned that things happen in labs. Sometimes the genotype result is not quite accurate. It's not 100%. And that's why I'm adding, if you test the one time, it may not be sufficient. If I knew this then, I would have retested twice or three times in two different places just to reconfirm and make sure that everything is 100%.
Wow, that's heavy. Like someone says, it says this is a rich conversation that needs to be shared with more people. Yes, that's testing and retesting, because,
Yes.
like you said, you know, things can happen. And I'm sure you're going to still share your story with us so that other people who have actually tested ones and, oh, yes, yay, hallelujah, let's go ahead, would now start thinking again and say, okay, let's have a second opinion. So thank you very much for sharing that. But I think that takes me to asking a question, not out of that's out of from what you've just said, Abby and Obi, that you are to ask the partner, let's do a test. But how about people who weren't aware that they needed to even do a test? My question now is, were you actually taught or educated by your parents or in school, or how did you get to know that, okay, for you to have this condition you need to do this? How did that come about? Because not many people know that. Not even many people know their genotype. Not to talk about, oh, if you have this, you have to do this, you have to. So were your parents so good that they had to talk you through, or was it in school? Tell us your story.
Well, I guess I'm lucky. My father was a radiographer, so my father is in the medical line. But even at that, it was taken for granted. Okay, so I went through school, and then I graduated, and of course, when I started dating, it was a serious relationship. And at the point where he proposed and we continued, and he said, okay, it's the time for us to go talk to our parents and let's see if we can begin discussing dates, possible dates for the wedding and formalize introduction. We went home, and of course, I introduced him to my dad. And my father, as an afterthought, just woke up one day and said, hey, by the way, what's his genotype? Because you are AS. So you need to find out what his genotype is. I said, I don't know. And then I called him, and my father asked him, well, what's your genotype? He says, I'm O positive.
Okay.
And that was the blood group thing. We all know about blood group, but not everybody knows about genotype. So I wasn't quite educated about what my genotype was until that point when it became a thing. And my father sat both of us down and said, hey, it's different from the blood group. Okay, so both of you go test and find out. We went to test. I was AS and he was AS. And it was tough, but we had to make that decision. And then my father gave me an example. We had a relative, I remember vividly, she had 7 kids. And as at when this was happening, she had lost 3 of those 7 children. And the best way my father could give me an example was to say, hey, your aunt so and so, those children that are always falling sick and dying, this is what is causing it. This is the reason why they are sick. So this is serious. You cannot, marry somebody who has an AS genotype. And of course, we both had to go our separate ways eventually. So that was how I stumbled on my own education, you know, at a very late stage of my life.
Wow.
But that was how I came about. And my father started explaining that he as well, he didn't know he was AS until much later on, at some point in his life.
Okay, thank you very much, Obi. How about Abby? Because you are living with the condition. How did you
Mhm.
get to know?
So
What's
mine was when I was a very problematic child growing up, health wise. So when I was around 7 years, was it 7 or 6? One of my various visits to the hospital. So that time somebody had a birthday party. 6-year-old, 7-year-old girl, you want to go to the party. I remember my left hand was paining me so badly, but I just put myself together and I just had to be at that party. And the party was one of our family friends. I remember very well. I think Dr. Ogunsanwo or something. So at the party, I couldn't endure the pain anymore. I started to cry, and my father said, this child, she has always been, and the man looked at me and said, and called my dad, have you tried her for sickle cell? Have you tested her for sickle cell? She looks like she might be having sickle cell crisis, pain crisis, the way I was describing my pain. The man was a medical doctor, bless his soul. So he was able to give me some pain medication. And trust me, I had to enjoy the party, right? So from there, my father got very increased, very curious because my father, he knows, a little bit about sciences. So we decided to go and test me again and everything. And they realized that, wow, I had sickle cell anemia disease. And somebody like me, I'm very, very inquisitive. Very inquisitive. I used to read a lot of newspapers. When I was in JSS 1, I was very vast in Nigerian politics
Wow.
at 10 years old.
Wow.
So I was, my we didn't have a lot of tools then. There was no internet in Nigeria. There was no, but I would read anything I could lay my hands on. Then I would ask a lot of questions on my hospital visits and everything. And there was another doctor that was our family friend then. We used to go to that hospital. He would tell me a whole lot of things about diet, about this. I was always asking questions because I wanted to be a normal child. On a Saturday in the morning, I wanted to wake up and go outside and play. I didn't want to wake up in pain. So I was very inquisitive. And I guess that was how I started to pile up, information about the condition and everything. Then I was introduced to a hematologist very early on in life. And I would go there, and the guy, I would just gather any information that I see. Then when I was in college, I had a friend that the mom was a nurse in Louth, introduced me to another hematologist in Louth, and that was like the bam. I would go there like every 2 weeks, and the guy would just, you know, give me magazines, give me everything I needed to read. And I think that was where my passion for mentoring, it started to develop from there because I realized that if people have information, information is power. I realized that if we have information, we're going to be very powerful. A lot of things that we think we cannot do with information, you can do it. But one obstacle that I realize in Nigeria, I have to say it, is the truth, the honest truth, is religion.
Mm.
When you tell people not to get married because the two of them have the S genotype, you begin to hear things like there's nothing God cannot do.
Faith.
It's so frustrating, penetrating the Nigerian religious group with
Mm.
that information. They make it impossible. And from my experience, they spread sickle cell. They spread it because they make it extremely impossible. Because if you come abroad and the white race and all other race, there's no cure for this thing. They eradicated it by education. You understand? So when I was very young, before I got married, my pastor had to pull me in to mentor a lot of people. And I've met along the way is one resistance or the other. That's why I said once people are determined to get married, it's like a moving train. They're going to get married no matter what. Until they get married and they have the kid and they're like, oh my God, this is what you were trying to tell us. Like,
Mm.
yes, because I'm that child. I'm that problematic child. I want you to enjoy your life. That's why we're telling you. And that was why I was so resolute that no matter what, the first time you are coming to ask me out, we're going to test that genotype. So I hope that answers your question. I
Wow.
just
Yeah, yeah, and I'm just surprised now thinking about it. you went to a boarding school,
Mhm.
parents must be so bold. So I'm like, okay, let her go, explore. You went to a boarding school, we went to the same school together for FDGC Akure, for those here in Fejikola, we call ourselves. So,
Yeah.
it was it was so inspirational to see that actually it's not the end of life. For those who are living with the condition, you can here is a living example for you. You've had your own children, you've managed the crisis, and you still have the sickle cell condition. So it's not doom. It's not all doom. Yes, you go through something. But before we talk about the complications of the disease, we were talking about the cure. There was an article that came out recently about that's talking about the sickle cell revolution. This one came out on the 20th of February, just a few weeks ago. Talking about the cure. It's on BBC, and I just want to go straight to where it talks
It's
about.
talking about gene therapy.
Yeah, it was STEM. Yeah. So this person was talking about, how he felt when he did the thing. He felt born again. He said, let me read that part. It says that it's like being born again. It says when that, the pain he used to feel normally, he was even expecting it to come, but he didn't feel it. So I feel that's a step forward. And it says how it works is, they take stem cells and extract. So it's like what Abby just said about stem cells, and two people have actually benefited from it. So
Bumi, can I just jump to this, talk about this cure quickly?
yes,
I,
please.
I
Yes,
think I
please.
have a little contribution here.
Okay.
Um, so there has been research about the cure for sickle cell for over 30 years. And the first cure that they started working on was the stem cell uh, cure approach, which is popularly known as the bone marrow transplant. And quite a number of people have gone through the bone marrow transplant as a form of treatment, both old and young, and it has been very, very successful, as a matter of fact, over the years. So that is an option that people can explore as a cure. It's actually available in Nigeria. I know that there are about one or two hospitals that are equipped, or even more. The last I know, about two hospitals are equipped, and Nigeria has a lot of qualified hematologists who are also very passionate about the bone marrow transplant research, and they've been doing a lot of work in that regard. There are hospitals in India, there are hospitals in the US, North America, and all over the world. So people can actually explore that as a course of treatment. The most recent research is for cure is the gene therapy, which is the one you see there in the publication.
Okay.
The difference between the two, excuse me, is that for bone marrow transplant, somebody else has to actually donate their bone marrow, and that has to be used in the course of the treatment. Gene therapy, on the other hand, explores taking the individual's blood and then processing it through whatever means that science has provided, and they're using that same blood to treat the condition. So that's the difference. So gene therapy is supposed to have less risks of the complications that may arise as a result of using a donor's bone marrow versus using the bone marrow of the individual themselves. It's still a very young research,
Mm.
but they seem to be recording quite a good number of success. But there's a lot of clinical trials
Yeah,
still
going
still going on. And then
on.
in very recent times, precisely sometime September of last year, there's a medication. I think by Novartis, if I'm wrong, there is actually a medication now that is out there. It's not a cure, but it does help prevent occurrence of crisis. I
Mm.
think from teenage years upwards. It's becoming very popular across the world. Unfortunately, I cannot remember the name. But again, we're not doctors, so if you're interested, you can speak with your hematologist or your doctor. I'm sure they would know. It's available now. The patient takes it once every month, and it totally takes away the possibility of a crisis occurring. So it's a good thing that science and
Mm.
technology is doing a lot to
Yeah.
to help.
Yeah. Great. Because I know you must have visited a lot. You have so much information. You're almost like an assistant doctor. Almost like you have, I'm sure you have read so wide.
You don't
This is
want to try
this
the
is
strength
my
of
life.
the
This is my life. I mean, it's been over a decade of me and this condition. I sleep and wake up with this condition every day. And so I have no choice. Knowledge is power, right? The If you want to live with this successfully, and the thing is, the experience of people who carry the condition, like my darling Abby here, and the experience of the caregivers, those of us who are parents or family members of people who carry this condition, is totally different. The experience and how it affects us, it's totally
Yeah.
different.
Environment also
Right.
differs.
And when you are the parent to a minor, a child who has this condition, it's your job to find all the knowledge you can so that you can help your child the best way you can.
And I think the caregivers do a lot, because I can talk from the experience of somebody that has the disease. I have I've just accepted the condition, that there's nothing I can do about it other than continue to educate myself, whatever I need to do to prevent a pain crisis, I'm going to do it and everything. But then for the caregivers, these are people that give up everything just to take care of their loved ones. And I appreciate the perspective Obi is bringing into this. It's a lot. And that was why I was resolute. I'm like, I'm not going to be a caregiver to a sickle cell child. I'm not going to do it, because I know how my parents
Suffer is the word.
cried and suffered. Let me share one experience with you. Growing up in Nigeria, anytime we're going to the hospital, right? So I'm in the hospital 24/7. It's like children going to um playground. I'm in the hospital 24/7. So I didn't have any medication that I could hold like I do now, to manage it, to manage the pain and everything. And every time my parents just have that terrible experience. So many times I've seen both my parents break down and cry. So before the lockdown, my father came to spend some months with me. So I had a pain crisis. One of those that I couldn't hide. So I'm like, oh my God, where's my medication? And my father just went from 0 to 100. What? Oh God, let this be me, not my daughter. He just started all the rants, and I'm like, Daddy, it's okay. It's okay. I'm in the US. I can manage this thing better. And I said, so he just went from 0 to 100 like that. And I just felt sad. So I took my medication. I had to convince him that once I take my medication, I'm fine. He was not convinced. So after taking my medication, I made sure I sat with him. I was gisting with him, just for him to be convinced that I'm okay. It's fine. When you go back to Nigeria, don't think about me like that. I'm fine. So the caregivers, God bless your souls. The same thing with my mom also. They will just go from 0 to 100. I'm the one with the pain. I've not gone anywhere. But for the caregivers, they just go like that. So it's a
Well,
good
you're the one with the pain, but your pain is mental, and it's your pain is more physical,
Physical.
right? Is more physical. Physical pain is bad, but sometimes physical pain is easier to deal with than the pain that is mental,
Emotional.
psychological, emotional. I mean, it takes everything away from you, literally.
Yeah.
You are in pain. You know it's because you're in physical pain that you have to be in hospital 24 hours. For the people who take care of you, everything else is at a standstill. They have to be there with you. They are bearing this pain with you, but they cannot take the pain away from you. They feel helpless, they feel hopeless, and that in itself is there's
Torture.
a word.
It's
It's
torture.
so traumatic. It is so traumatic. And every parent at that point in time is thinking, oh my goodness, how did I miss this? What could I have done to prevent this? This is my fault.
Mm.
Every parent that has a child with sickle cell goes through what I'm telling you. It's very tough and it's very difficult. And unfortunately, that is the part that nobody talks about. And so that's why I commit myself to talking about these things. Parents and caregivers of people who have sickle cell anemia, they go through a lot of mental health issues. Most of them have their lives, drained, depressed, afraid. And it's so hard to express it and share it and get comfort because the society at large judges you even before they hear your story.
Mm.
They're either judging you or they're judging your child. I mean, in those days, I don't know if you remember, they would call those children Abiku. They
Yeah.
would say it's an evil child, a child that came and died and came back and died and came back. That myth has been around for thousands of years. But I can tell you that it wasn't Abiku, it was simple sickle cell. It was simply the sickle cell condition. Children were dying and nobody had a clue what was going on with them.
Yeah.
All right. But now we know.
Mm.
Now we know, and then we have to help ourselves. Abby, you made a very valid point that our biggest problem is probably religion. But religion is the one thing. There is another big problem, and it is just lack of awareness. Even people who are not religious, how many of them understand what genotype is? How many people have even heard the word? It will shock you. Rural Nigeria population is huge, bigger than urban Nigeria.
Mm.
And how do we? So the challenge for us right now. I mean, thank God you are living well with this condition. Thank God I'm still doing everything I can, going the journey with my child, trying to find what works and find a solution, a lasting solution, right? But in the interim, how do we educate people? How do we translate the word genotype to Yoruba, Igbo, and Hausa?
Mm.
Such that the man on the streets, in his language, knows what this thing is, what it means, the far-reaching implication. We have people in rural Nigeria marrying 4 wives and having 30 children. Every single day, there are kids being born and they have this condition. We keep replicating this painful scenario. So education is important, not just in the religious circles, but we must look at it from a sustainable standpoint. What can we do, beginning from the grassroots, to help?
Mm.
There are a lot of things you can do to manage this condition. I mean, it's here, it's here. We already have the condition, anyways, we're living with it. If we have it, how can we begin to manage it? So there's how to manage it as a home, as an individual, and then we can start talking about what we can do as a society as well to prevent it from increasing, and what we can do as a society to help others who are living with it manage it more effectively.
Yeah, thank you. I'm sure we'll get to that management bit soon. But what I want to ask, what are the complications, Abby? What are the complications of the disease? You live with it. What I know
Okay.
you've given an example of you when your dad was there, and but what are the unseen complications that could arise?
Okay. Okay. So, like Obi explained at the beginning, when the sickled red blood cells clog together, they block the flow of oxygen.
Yeah.
They are basically useless. They can't help the body produce oxygen. So they just block the flow of oxygen. And when they come together, that is when we living with the condition, we have pain crisis. So pain crisis is a regular complication of the disease, right? But there are other complications. So let's think through it, and that is one thing that we suffer when we visit our healthcare providers, because we have sickle cell, almost everything is attributable to that, which is very, very sad, and it's our reality. So when oxygen cannot go to your brain, what happens? Paralysis could happen, right?
Stroke.
Blindness, detachment of the retina, it can happen. When the sickled shaped cells, when they clog somewhere, I'm not a medical person. I don't know how to
You're
say it.
doing great, Abby. Just, you know what? You're doing great. This is how to describe
Yes.
it.
When they
Yeah.
clog there,
Yeah.
oxygen cannot flow. The veins that hold the retina together,
Mm.
it becomes weak and at times could drop the retina. So that is blindness. Retina will detach.
Mm.
So for that, I like to start from here, then I walk it down, right? For that, we living with the condition, with the sickle cell condition, we need to see a retina specialist once in a year because there's a living threat of blindness. And that blindness is as a result of complications of sickle cell. The type of blindness is your retina can detach. I have seen retina specialists in the US. When I say retina specialist, is separate. It's not the same as your regular eye doctor that you go for eye. No, 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 no. These are specialists that treat that look at blindness from the point of a genetic disease.
Mm.
I'm not saying you're ophthalmologist. No, I don't know the name, but is a retina specialist. Like, for example, people that have diabetes, right? Blindness is also a living threat to them, right?
Yeah.
So these people also see this kind of specialists. They treat, they look at blindness from the point of that has a root cause of a disease. I see them once in a year. I will advise everyone see a retina specialist. The first time I went there, the guy was so scared, took the x-ray of my eyes. My left eye was just gray. My right had orange. He said the orange is a healthy one. The gray one shows there's something wrong. So he educated me about retina detaching. He told me the symptoms, which I have some of it already. Showed me the symptoms and went to come for help immediately. And he told me that the retina can be fixed with LASIK surgery if it's within maybe 24, less than 48 hours, that he can fix it back. So that is a living threat of sickle cell. And for me, that is very, very serious. At least we can prevent that by doing this regular annual checkup. Not ophthalmologist, not your regular eye doctor. These are retina specialists that treat blindness, that look into blindness caused by diseases. So I've spoken about two complications. One is paralysis, the other one is blindness, and the other one has to do with your organs. When oxygen cannot flow around your body, oxygen is like the food, right, that your internal body needs, right? So the organs can be affected. A lot of people with sickle cell, their spleen has been removed. They have complications there. Or organs, so when we go to the hospital, the first thing they try to do for me is to make sure that my organs are intact. When my organs are intact, then it's a simple thing. It's just the pain, right? Then they can treat the pain. The pain, it's not going away. There's nothing anybody can do about it. They can treat it. But if one organ or the other is affected, then that is serious. That's when the admission comes in and you stay months and months. So anything can go wrong, with the organs, right? And other things like nerve complications. It begins to happen like in once you're getting old. Just imagine anything that can go wrong if oxygen does not flow around your body. I'm very sorry, I don't have the medical terms, but the ones that really, really bother me is the paralysis and the blindness by detaching of the retina. So please, if you have sickle cell disease, please check your eyes. Not your ophthalmologist, not your regular eye doctor, is a retina specialist. I thought it was a regular eye doctor, but they told me it's a retina specialist.
Okay. Before I ask Obi to also thank you very much, Abby, for those itemized complications. Before I ask Obi, I'd like to tell those on Facebook watching now, please go come and join us on YouTube so that we can have all your questions and answers on one page. So if you're watching, you've got questions, you've got comments, you might even have an idea of something they haven't said, please write it in here and let's learn together. We are here to create awareness to people who need this information, because every one of us need, in fact, everyone, either you're AA or whatever it is, we all need this information, because we want to be able to help our neighbor when they're suffering through that. I remember when we were in boarding school, you just hear, oh, the person has a crisis. There was someone in my class had a crisis. I didn't know what to do. I was just here, hey, what do we do now? All we just had to do was take them to the dispensary, wasn't it? Dispensary. So we all need to know what to do to help other people who are going through it. Maybe you don't even need to hold them, because holding them, you're shortening the blood flow, and we don't know. So learning from you guys now would really help. So Facebook, join us on YouTube. I'll be stopping Facebook from now. Okay, go on. Obi, can you please tell us what are the complications you've seen your child experience?
Pain. The number one overarching complication is just that, unoptimized well-being. The child is just never well. More often than not, there's always pain. And like Abby said, paralysis, I think, is the number one. I would like to use the word stroke. Stroke is the most common, potentially easily occurring complication of sickle cell. And it just happens easily by, having that crisis in a spot. And the crisis does not have to be, there are different levels of crisis. Sometimes the pain happens and is mild, just a mild analgesic might be able to help the situation. Sometimes it's more serious than that and the pain is severe. Now, the danger is, depending on what part of the body this happens, it might end up in a stroke. Stroke can occur in patients with sickle cell anemia at any age. In Nigeria, we always assume that it's only maybe people of a certain elderly, age range that can have a stroke. Sickle cell is one of those conditions that can throw a 2-year-old child into a stroke if care is not taken. And that's why you will notice that quite a number of sickle cell patients, sometimes they either walk around with a limp permanently, or with some form of challenge with their hands. One of the limbs somewhere would have been affected. That is a result of what stroke can do. And so it's important, particularly for parents and for people with the condition, in case you do not know, you need to do something called a transcranial Doppler test periodically. Transcranial Doppler, or call it Doppler. It's a scan where they scan your, I don't know what the right word is, but they check from the brain, particularly from the head here, and they scan your nerves and everything, and just make sure that those parts of your head, like Abby said, we start from the top. those areas where blood flows through that are responsible for supplying oxygen to the most important organs of the body, they want to make sure at every point in time that it's a free flow and there is no blockage. It's very, very important. On the average, depending on what they find, you may have to go through that Doppler scan 3 times a year. If you don't seem like you have any risk, you can go through it once a year. And so my advice is find a hospital. If you're in Nigeria, go to your general hospital or the national hospital. Hospitals like University, is it last help me? Lagos State University.
Teaching
Yes,
Yeah,
hospital.
yes.
yes.
Find the teaching hospitals. Find the general hospital or the teaching
Government hospital.
hospital. They always have at least a sickle cell unit or department where they can educate you. If there is no Doppler scan in your vicinity, please gather your community. If they need to donate money for you or whatever, try and find your way to the nearest teaching hospital where you can get a Doppler scan done for yourself if you are the one having it, or for your child if it's a minor. It's very, very important. Why? Because stroke is it's one of those complications that is irreversible. Okay, it is irreversible. If a damage occurs as a result of that, you may not be able to regain use of that sensory organ or limb or whatever part has been affected. Now that's that. Let me leave that one there. The other complications is that people with sickle cell anemia, they have compromised immunity. They're not as healthy as other people. They are susceptible to infections. If you have a common cold and flu today, the way it will affect you, Bumi, is different from the way it would affect a person living with sickle cell anemia. Your own cold and flu will give you catarrh. You just blow your nose and throw your napkin away. The person living with sickle cell anemia, that catarrh, the stress of blowing that nose can trigger a crisis. And so because their immunity is low, it makes them susceptible to having infections more frequently than other people. And you would then find people with sickle cell anemia having things like tuberculosis, coming up with things like osteomyelitis, which is also a condition of the bone, where they have complications in their bone marrow. You will have them come up with things like leg ulcers. They just wake up and there is a cut, and instead of it healing, it just keeps getting bigger and bigger and bigger. There's so many complications that can happen as a result of sickle cell. So many. And that's why this thing is so dangerous. Sickle cell does not show you symptoms. You will not. I tell people, I said, I have a boss that is very disrespectful. My oga is sickle cell. Sickle cell does not give you symptoms. Sometimes you might feel that you have a crisis coming up. When you're an adult like Abby, like you said, oh, let me get my medication. I think I'm coming down with something. How does a child know that sickle cell a crisis is about to happen? Children don't know. It doesn't show symptoms. Sometimes there is no fever. You see a child playing the 1 minute, the next minute that child is down, crying, sick. Before you know what's happening, you find yourself in the hospital, So it's part of the complications. Literally anything can happen that can take the quality of life from somebody living with sickle cell anemia from 100 to 0 if it's not properly managed. So almost everything that can go bad with an organ is a complication that can occur as a result of sickle cell.
Wow. Enlightening. Thank you very much.
Thank you, Obi. You're doing a better job than me. I'm used to the condition, and I'm just like, caregivers are angels. They actually know more than us. Like my husband will put me on a routine. Once I tell him something about my care, he just puts it on his alarm, then puts me on a routine. If I don't follow that routine, he'll be like, I will just stop talking to you until you do what you're supposed to do.
Yeah, because he knows what we have to go through. If anything happens, he knows what he has.
Yeah, thank you. I think caregivers are extremely educated, about the condition. I'm blown away. Thank you, Obi.
Femi Tijani says sickle cell is an invisible enemy. He's really saying thank you for educating us. Thank you. Thank you for joining us here, Kemi Tijani.
Oh, Kemi happens to be Kemi. You should come on a Bumi show sometime. Yes. Kemi is a sickle cell warrior. She's not just a warrior.
Oh.
She also went through one of the interventions, and as a matter of fact, Kemi just published her 2 books.
Wow! Oh, come on in. Let me share the StreamYard with you. And
she's the founder of Flourishing with Sickle
Cell. Warriors who have gone through it, and God is helping to stand. You're still standing. Oh, blessed be God. So I would like to share. I'll share the link with you. I don't know how I'm gonna do it, but I'll get it sorted. While we're talking, I'll try to. You can come on the screen, and show us your face and tell us about your book, because so many people want to see this. Some people are just, apart from videos, some want to just sit down and read, into what this thing is all about. There's so much information out there, but we need, ones that would really streamline our understanding and give us more information that would I say that speak our language, if you get what I mean. Because when I was talking about getting people to do this, someone was like, we have so many doctors on the platform. I said, I know doctors are well informed, but I don't want theory. I want practical. I want people who have gone through it, who will tell you what exactly they are feeling. Doctors would, yes, I really appreciate their knowledge and all that, but by the time they start going through the I can't even say hemoglobin and the red blood cells and the white blood cells and all of that, people will just be like, okay, yeah, theory, but I want, so what I'm getting now is really what I wanted, and that's why I didn't want to speak with you before now to see what what it's all about. I want to hear it firsthand from you. So thank you very much. Kemi Tijani says, this is my 7th year of freedom from sickle cell. Wow. So you're going to share, you're coming up on the screen. While I'm trying to bring you on, I want to ask a question. What does a crisis feel like, and how often? The reason I'm asking is this. You hear, crisis, and I'm thinking, is it like muzzle pull? Is it, is it like giving birth in a labor ward? What is it like? Is it possible to put in words? From
take it from labor pain and go higher. Abby, describe.
Really?
I can describe it.
Language.
You see, that question is very real. It's very good. My parents have asked me so many times when I'm crying or screaming my head away in the hospital, to say, describe your pain. How do you feel? I'm like, how do I describe it? So the description I've given them, which is very funny, I don't think, it's like, if you just break your bone a little bit, you know how painful that can be, right? It's like somebody is trying to penetrate my bone using a nail and a hammer. And all the time, this is heavy nail, and all the time the person is just pounding away. And it's just that constant pounding. That's the way somebody else might describe it in another form. That's the way I can describe it. And that's why when you have people with sickle cell and they have that pain crisis, they will just cry. Somebody like me, I take my medication all the time when I know I have crisis. And if I allow the medication to wear out before I take another one, that interval, you see me shed tears. And they will just cry because it's not a pain that you can hold. You can't. Just imagine if you've had any form of bone pain, maybe you broke your ankle or anything. Just go back, imagine that pain, then imagine somebody bring a big nail and a huge amount just pounding away like that. And at times it could be one part of the body, at times it could be multiple parts. There was a time, and there's something talking about complications. There was a time I had that pounding pain in my spinal cord. And I started thinking, is it because I did CS when I wanted to have my children? All sorts of things were happening because I never experienced the spinal cord part of that before. So my doctor, actually, my regular doctor that I see, not my hematologist, my primary care, she thought it was something else, So I did an X-ray, and they said it's degeneration of something, some of the disc, right? So she told me to go for physical therapy. I went for my first day in physical therapy. I came down with a crisis. I had a crisis. So I went again. I had a crisis. And I told them at physical therapy that I have sickle cell. I can't do all these things but they just did not understand it. So when I went to the ER 2 times, I'm like, no, this is too much for me. But my back was still hurting, And the lady said, oh, okay, let's use heat therapy for you. I was in physical therapy for 2 years. Nothing changed. So I decided to see a spine specialist. And the guy did some tests, told me to go for MRI, blah, 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 blah. And he came back and said, you know what? I think it's sickle cell.
I was waiting for you to laugh. You would
give me
in. I was waiting to see.
I was your file.
The guy gave me a prescription pain patch. You understand? He now educated me how pains in that area can be managed, He now said, use this pain patch for 2 months consistently. Pain or no pain, it doesn't matter. Just put it there, And I did that. And since that time, I got relieved. That pain in the spinal cord is special. I don't know how to describe that. I don't. It's a special kind of pain. I couldn't sleep for 2 weeks. I couldn't blink. That pain is special. But now I have that prescription patch that is like I hold it dear like my Bible.
Wow.
There was a day I was going to work. I experienced pain in my spinal cord. I'm like, there's no point. I just sat down in the morning, and my husband said, Abby, the pain patch. So he went and got the pain patch and he put it there. And 20 minutes after that, I was ready to go.
Yeah.
So that's the best description I can give it, right? But that description of the hammer is different from the back pain. That's different. That one
it's
is
like your toothache, those severe toothache. I don't.
Toothache is severe. Yeah, toothache is severe. Toothache is severe. I can compare that to a mild crisis.
Okay, on a threshold of 0 to 100, where would you put sickle cell? Where will you put toothache? Where will you put?
No, I said I can compare toothache to a mild crisis in a sickle cell. A mild crisis. When I have mild crisis
being like, let me paint the picture for you.
That's
Mild crisis being like you have a mild headache.
Like if when we go to the hospital, they say describe your pain on a scale of 1 to 10. So mild crisis, I would say, is a 2, at most a 3. But the pain that will make somebody like me cry, break down, helplessly cry, begging for pain medication, it's at least a 7. and up.
Is it cry or will? Abby, describe this thing, please. Tell
Oscar,
me.
When I was a baby, I would wail.
oh,
But now I have to put
we
myself in
will
order,
absorb
right?
it.
It
Right.
is hard.
Everything's fine.
My kid, my son describes it like, and this was when I asked him when he was 5 years old, was when I got him to try to describe in the words he could find. He said, Mommy, he's like somebody taking that big saw and cutting into my bones, and they don't stop
Oh,
slicing it with
oh,
the saw. How do you even describe that kind of pain?
oh.
The worst pain people can usually imagine is they would say labor or toothache. It's nowhere near it.
Hmm.
And
I've
so,
experienced labor. So labor is like for me is on a level 2 out of 10.
Really? Oh my
yes.
I've experienced labor twice, so I can say that.
And so
God.
this is why it is so important that
Yeah, I think Obi's frozen there.
Yeah,
Yeah.
obviously. Okay.
Sorry, you're frozen, Obi. You
and
say
there
that again. Sorry, before you say that, Queen K, welcome, Queen K, my particular sister. You are welcome. She's asking, she's saying, "Oh, this information is very useful. I will want to share with a few people. Is it going to be available after the live? Yes, it's on the same link. They can watch it after. And yes, let's share it. Let's educate people all around the world. Thank you very much for doing that. Yes, like you were saying, Obi, a
like
soul.
I was saying, this is it's the pain is unimaginable, and so that is why it's so important to understand that people living with this condition, or people families who have people living with this condition, please show them empathy.
Hmm.
Please have compassion, because you cannot imagine what they're dealing with. The pain is hectic.
Wow.
People living with sickle cell condition, they walk around every day, they still struggle to hold up, to still stand strong and live up to expectations in spite of the pain that they're going through.
Hmm.
Sometimes they have what they call mild crisis. Please do not be deceived. Their mild crisis pain is like when you and I have the worst pain from the most terrible dental extraction you can think of. That is what they describe as mild
Hmm.
crisis. And they still manage to get themselves to the office. They still manage to get up and sweep. They still manage to do the little bit they can do in the house. They still manage to go out and move around. Please show them empathy.
Hmm.
Because what they are living with is no joke. It's tough.
Wow. Wow. Thank you. Thank you.
Thank
Thank you
you,
for
Obi.
describing that.
You're way better than me in this thing.
A child to say is like so using a saw on your bone. It's and you also said, so it's bone related.
Abby, they're saying I'm way better. I'm not way better than you. Um, I am with you. I know what you go through, and this is what they do. People who live with sickle cell anemia, they always tend to how do I put it? Because they are so
Cover up and you don't.
yeah, not cover up, but they tend to try and not make it look as bad as it really feels. But
Hmm.
I'm lucky because I've cared for a child, and the innocence of children. So my child has been able to give me the full expression of what this thing feels like.
Hmm.
And that's why when I'm in conversations with people who are survivors and they try and make it look mild, and yeah, we laugh and we smile about it because there's no crisis going on right now. I I respect that, but I also encourage them. As an adult, you can manage it now because you're an adult, but don't forget that there's people who are just stepping into the stages you have passed.
Hmm.
You have children, you have teenagers.
Hmm.
You need to describe this thing so that they know that you truly get where they are.
Hmm.
Don't forget where you're coming from. So let's say it as it is.
Yes, yes, yes,
No
yes.
coating, no buttering, no frosting. This is the bare flour. This is the dough. That is
Mm.
how it is.
Wow. So
It's okay.
how often is this crisis? I know how well consider yeah, apart we'll say with the mild, just pain on its own. How often do you experience pain?
Okay, I
For
can
me,
answer that.
it's
It's
not like
all the time.
it's not like a period that has a schedule.
Is it? Well, I'd be saying it's
It's,
all of the
it's
time.
exactly.
Even as
It's
you're
all the
sitting
time.
now, as you're sitting
So
down here.
somebody suffering from sickle cell, you have pain, but at various degrees, right? So the one that makes you cry and run to the hospital, that one develops if the little one is not cared for,
Mhm.
you see. But you have pain in one form or the other all the time. When I started seeing a pain specialist, a pain management specialist. They call them, is it palliative care or something like that? And he gave me some medication and said, you have to use it like every night. And I'm like, no, I'm not using it every night. Why am I using medication every night? He explained it to me and everything. And I'm like, you're correct. That time I would take a leave, right? I'm not sure if you're familiar with a leave here, Bumi. Our leave is ibuprofen. It can be compared to ibuprofen.
Yeah.
Like if you take like two or three of it, it has the strength of like an oxycodone,
Mm.
a prescription pain med. I will take three before bedtime, wake up in the night and take another three. That I have to roll like that, right? So when this man now told me to be taking it every night, gave me a prescription. I'm like, why would I take prescription every night? And blah 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 blah. You guys say you are in constant pain, you don't know it. You have learned to live with it. Then I reflected. I'm like, that's true. I normally take a leave. Their leave is the pain medication you can get across the counter. I'm like, I normally take a leave. If I don't take it, I can't fall asleep. Then I
Mm.
wake up in the night. But most times with sickle cell warriors, we wake up in the night with a lot of pain. And you know why? There's less oxygen circulating at night.
Mm. Wow. Wow.
So you don't have enough in your body, then the environment you're in, it tends to reduce. I just saw that in an article I read this year, actually, that is because before I used to dread going to bed. Let me tell you that. Because
Mm.
I know most times I wake up in pain, then
Wow.
I'll start crying. And when I don't know if Obi has experienced this with a child, when we are in crisis, it intensifies in the night.
Yes. In fact, most of my child, more often than not, the very serious crisis that he has is usually starts sometimes between 12:30 and 1 a.m.
Yeah.
Yes,
Wow.
So
the most severe ones
the
always.
frequency of the pain is like it happens is there. The pain is there. It's not going away. It's not like your body stops producing blood. Don't forget what causes it. It's like is the sickled shape red blood cells, right? And those ones are useless. They are not going anywhere, right? They are circulating in your body. So anytime they have the opportunity to come together, that's when you have pain crisis. So it's there. I don't know how to describe it. It's not going away. Is there. The only thing that you can do for yourself is to make sure, for us, is to make sure we are hydrated. We have
Mm.
something we're drinking, drink water, drink
Yes.
whatever. And my hematologist has encouraged me to come in. Now I come in every 2 weeks for hydration. Before it used to be every week. And when I go, before they give me the hydration, they will test me again, test my blood, and just make sure that my medication is there's no complication from the medication I have. They will screen everywhere. Then they will give me drip. They call it drip, right? We call
Mm.
it hydration. So I take that. I used to take that once every week, but now I'm once every 2 weeks. It just depends. At times I'll go in for my regular hydration, and they'll be like, "Oh no, we have to give you iron today." And at times, like you have to go to the emergency, you need a blood transfusion. It depends. But for me, that is how I manage it. So just know that at least once in a week, I'm with my hematologist taking hydration. But this year I've tried to, once in 2 weeks, because I have, then I buy electrolyte across the counter. I just drink it. Anything liquid that can help me, because what you need to do is, if you understand how the crisis starts, those sickled shape cells, they come together. What you need to do is to prevent them from coming together. And your
Okay.
body is always producing it. That's why when we have crisis and we run to the hospital, the first thing they do before they do anything, they put you on a drip. The reason why they put you on a drip is to scatter those cells that have come together. They want to
That's flushing
scatter.
it.
Yeah,
Yeah.
they want to flush
And
it. I'm not a medical doctor. I'm sorry.
yeah,
That's
I'm
the way I
just
can
trying to
describe it.
see. Yeah.
Yeah, and the doctors will when I was in Nigeria, my hematologist will say ordinary folic acid and water will help a long way. That those are the magic words. And if you tell me to, say it again, what are the magic words? I will say folic acid and water. Magic, folic acid and water.
Yeah. I know Obi has to leave soon, and I'm trying to round this up. I know we're enjoying, well, should I say enjoying? Well, we're absorbing a lot of information, not enjoying, because there's nothing to enjoy with this. It's a bit sad, but it's a happy moment because you're learning a lot to know how to help other people. But I don't know where to place it. Hearing all the pains and all the stroke, and it's like it's weighing me down. But I'm trying to hype myself up now to say, okay, I know you're gonna have to leave soon, but are there triggers? Are there triggers of this crisis period you've noticed, so that other people who are going through, or people who are going through it, could help them when they see that maybe they're overworking themselves or they're being stressed, or I don't know, are there triggers that people need to watch out for?
Do you want
Oh,
to
yeah.
take that, Bobby? Mhm.
Okay. As a parent, really, again, I don't have the condition. My son does. As a parent, what I've noticed is that stress, and stress is a big word that could mean 1,001 things. Whatever stress represents, I'm sorry, my I'm sorry, I'm a bit distracted because my computer, not now, just since I just saw a pop up that it wants to restart. Sorry about that. Stress, whatever stress could mean a lot of things. Stress can trigger it. Dehydration can trigger it. Dehydration simply means not your body doesn't have enough fluid for it to function at that point in time. Everybody knows that water is important, fluid of any form. The doctors encourage us to drink, is it at least 1 liter of water a day? But for people living with sickle cell, they have to do a lot more fluid. My child at the age of 3, we started working on a therapy, trying to see how we can get him to take at least 3 liters of water every day. That's a lot. But you give it in bits, small bits, mix it with Ribena, orange juice, whatever. Just mind the sugar and do as natural as possible. But dehydration can trigger it. Stress can trigger it. Physical stress can trigger it. Psychological stress can trigger it. Emotional stress can trigger it. I hear, because again, I'm not a patient, I don't have the condition. I hear that even menstrual periods for women, it takes their sickle cell crisis sometimes to a whole different level altogether. When puberty starts setting in, they also feel, pain. For boys, they have different things they deal with as well. Including in their privates, there's pain that goes on there as well. So yeah, anything and everything can trigger a sickle cell crisis. Poor nutrition can trigger it. And so that's why it's important. Hydration, proper nutrition, care, wholesome care, mentally, psychologically, physically, emotionally, wholesome care is what this our loved ones really need to reduce, sometimes environmental conditions. If they find themselves in areas where there's a lot of pollution, malaria is an enemy. Mosquitoes are an enemy. I say mosquitoes because I know that you might have an audience of our people who are still back home in Nigeria. I know so, and that's why for me, I had to leave because of my child. I had to find an environment that would at least give him opportunities and increase his chances for survival. Malaria is an enemy. Uh, poor hygiene can trigger it as well. So there's a million things. And that's why it's so delicate. That's why people are so delicate, because anything can just throw them into crisis mode.
Thank you, Obi. In addition to what Obi said, weather conditions can trigger it.
Mhm.
Extreme weather condition,
Yes.
cold weather, hot weather, especially when the weather is changing. At
Mhm.
that point where it's changing, and now that weather condition triggers it, traveling also, because traveling puts your body under stress. If you're traveling, maybe you're doing a road trip, try to break it up, because when you're traveling, and maybe during the summer you're traveling, in the car there's direct sunlight and you are cramped already. So from my own experience, most times when I travel, when I get to my destination, I have serious crisis. Then flying is part of traveling. Flying, I try to avoid flying except it's necessary. And why? How does flying trigger sickle cell? Because you're flying in high altitude. High altitude, there's less
Yes.
oxygen. So when there's less oxygen, you're going to have a crisis. Then apart from that, you have to look out for cuts, little cuts in the body. You just want to cover it up. You don't want to be exposed to any infection or anything. Then another thing that people don't pay attention to, where you live. I'm an accountant. I travel for work, right? So with that one, I don't have a choice. I have to eat. So I manage it. But I noticed that there was a time I was going to Salt Lake City for work. That was a completely different experience for me. Because
Wow.
when I fly, I prepare and everything. I know what to expect, that at the end of this trip or during this trip, I'm going to have a crisis. I prepare mentally for it. But going to Salt Lake City, it was completely different. And even when I went to Kentucky, just Kentucky right here, it was a different experience for me. Immediately, I was taken to the ER. Then I later realized that Salt Lake City, it's very high there. It's mountainous. All the homes are high. High. And when you want to drive, you're driving straight, down the slope and everything. That the topography of that place, because you're high up there, the oxygen is reduced. Then I realized that, oh, I had to make an official statement at work, begging them that please, I cannot go to Salt Lake City again. Let my team go. They bring the work. I'll do all the work, but I can't go again. So traveling, weather changes. Then times of the day, like we said, that evening time,
Mm.
evening time, the crisis tend to come or intensify. Then nutrition. Nutrition is another thing. When people talk about nutrition, they just tell us that, oh, reduce your carbs.
Yeah.
That's general, right? They say reduce your carbs, mind what you're eating, eat a lot of greens. Unfortunately, it works the opposite way for people with sickle cell.
Really? Wow.
It works the opposite. If you stimulate your blood production, stimulate your blood. Don't forget that is that your blood that is sickle, right?
Mm.
And is that sickle that is coming together because it's useless, that is causing crisis, right? And imagine you are stimulating the production. You see, it works opposite for us, right? And they will
Mm.
say carbs, carbs. For heaven's sake, we don't have energy. When I was growing up, they called me lazy or le. That was my nickname. tell me to sweep the floor, I want to run away. I couldn't do it because I know something is going to happen. You understand what I'm saying? I don't have the energy an average person has, And I know that when I fall sick and I go to the hospital, my doctor will say, give her bread, rice, and maybe coke immediately so that we can give her medication, right? But for the regular people, they say, no, run away from bread, run away from carbs. So for me, nobody told me this one. I just figured it out. I figured that it works the other way for those of us with sickle cell. I'm not saying eat too much carbs, but you need energy, right? So you can figure that one out. And and when you facilitate.
I'm sorry to interrupt, but I
Okay.
feel the need to quickly mention something quickly that is also a problem. And some parents are not aware that they are actually aggravating their children's crisis. We come from a place where self-medication is very popular, where we believe a lot in multivitamins, and multivitamins are fantastic. Have a baby in Nigeria today, I mean, an Abidec would follow, and all forms of multivitamins, both from well-meaning family members. Everybody would offer one thing or the other. Please, if you have a child who has sickle cell, do not give your child any multivitamin that contains iron. We load on iron because that's good. Iron is good for us. Everything they would say is because it's low iron, low iron. Your child needs iron, but only a certain level. And there is a thin line, and it's very easy for you to push your child over the tipping point. If you overload your kid with iron, or if you have sickle cell anemia and you're probably just binging out on all forms of multivitamins, thinking you're boosting your immunity, please ensure that you look at it and make sure it is iron free. That might be the reason why you keep having crisis and you do not know.
Thank you, Obi. Thank you. That was why I said nutrition-wise, it works opposite for us.
Exactly. Your biggest enemy might be hiding in your multivitamin and you may not know it.
Yes.
Wow.
What you need to take is folic acid.
Exactly.
Once in a while, your doctor would give you a prescription iron tablet, depending on what they see, or they will pass iron to you by IV. Consumption of iron with somebody with sickle cell, you have to rely on your medical provider to determine that.
Cell patients cannot
You
digest.
cannot just take multivitamin because people are taking. You see, so all those general advice that don't eat rice, cut down on your carbs. Don't Rice has folic acid and B vitamins. That is what we need. You see what I'm saying? They say consume a lot of greens. No, don't take iron. Iron has to be prescribed by your medical provider.
You do need your greens, but
Yeah.
greens the greens you consume, it's not likely that you would exceed what your body needs if you are consuming it in natural forms like vegetables and all that.
Yes,
It's not
exactly.
likely. But the
So,
minute you go and take a little tablet or a little teaspoon of multivitamin that is heavily laden with iron, it might push your body over the requirement that it
yeah.
needs.
Okay.
And so
And,
it's
I'm stressing nutrition
yes.
because, when you go to the doctor, like in the US here, majority of people, they are white. We blacks were in the minority, right? And the white doctors, bless their soul, they are not familiar with sickle cell, right? So they just treat it like any other. So the first thing they want to say, your diet, ma'am, make sure you cut back. Apart from the doctors now, when we socialize with our friends, right? Let's say you have sickle cell, and I have people with sickle cell, and they're on the fat side, on the plus side. They say, it's your weight. It's your weight. That is because it's not your weight, it's your makeup, the way your body is made up. So thank you for the opportunity. I wanted to stress the weather changes, the traveling, where you live, the topography of where you live. If you happen to live in mountainous areas, you have a chance that crisis will increase, And I gave example. If you live in America, Salt Lake City is I experienced health. I couldn't stay because of the mountains that are there. Infection, cuts. When you have cuts, little cuts and scrapes, you just want to cover it. You don't want any infection.
I saw
Thank
him
you.
pop up just now.
Yeah, so
Yes, I was about saying, I was about introduce. I wanted you to.
yeah, it would be nice if she can add to this
Kemi,
particular question.
yes, exactly. If
Kemi
you're
is a
still
nutrition
okay,
expert as well.
wait. Oh, great. So we'll wait for her to come on. While we're waiting for her to come on, I think her camera's gone off. I'll bring her in as soon as I see her come up. So yeah, so does that mean those with the condition is not advisable for them to say, oh, I want to be vegan, I want to be vegetarian. You can't afford to do that.
You can be anything you want to be. I don't like to say that you can be anything you want to be. You can live your normal life, but just be educated about whatever you're doing. You have to take informed decisions. Don't go with the crowd.
Informed decisions.
Don't go with the crowd. Informed
Exactly.
decisions.
You have to take informed decisions. And informed decisions do not come from even people who have experience. Let me stress that. Sickle cell presents differently, pallies differently, and demonstrates differently. It's the same sickle cell condition, but it's never the same person to person. So please do not go vegan because Mr. X, who also is living with sickle cell, does that and it is working for him. You can go to your doctor and suggest and say, Mr. X does this, it is working for him. Based on my physiological makeup, do you think this is going to work for me? So informed decision means advice that comes from your medical caregiver.
Yeah, thank you very much. Oh, you're welcome. Thank you very much. Nice to see you. Thank you very much for coming on, jumping on here to also
Thank you
add
so much.
your wealth of information. So from what we've said so far, before we do, I think we have about 2 more questions. Is there anything you've heard that you feel, oh, I could actually add that to that, I could actually add to this, or maybe that is wrong, that is not right? What is your take on what we've said so far?
Yeah, hello everybody. Hello.
Oh, Kemi's network is. Yeah, her connection just.
I know. It's well, when she comes back on, I will
hear from her. I would love to hear from her.
So, okay, yeah, she's come on now.
My
Yeah,
network is just
You're back.
amazingly crazy tonight, but I couldn't just refuse hearing the amazing information you ladies have been sharing. Can you hear me? Because I can't hear anything.
Yes,
okay.
I can hear you.
We hear you.
So anyway, all be good to see you and good to meet you, lovely ladies. You have said amazing wonderful things that I said, oh, that's okay. I don't even know that. All be well done with your wealth of knowledge. So one thing I can add, I've heard a lot about nutrition, which is amazing. Everything is on point. But I would just add 2 things that a lot of doctors don't say to their patients, and a lot of sickle cell patients miss this information as well. So the first information I'll be adding, because you have said everything really, so is the area of probiotic. For a patient that has sickle cell, they have been on this penicillin for years and years in order to prevent infection, because infection triggers crisis. So doctor place patients on that penicillin or carbapenem. But another thing the doctors don't tell the patient is to reduce, because penicillin actually kill off all the bad stuff that can cause infections that could potentially put a patient in crisis. But it actually kill our good bacteria as well that is responsible for our digestion. But we don't replace it, we just keep killing it. And this triggers other conditions as well, like leaky gut, not being able to digest. And for a woman in a childbearing age, probiotic can be so amazing. I wish somebody told me all this information when I was having my own child. But one thing I can just say is taking probiotic, whether it's in a supplement form or in the diet, can be amazing for a sickle cell patient. Because if we are killing off our good bacteria and bad bacteria, we need to replace it one way or the other. Otherwise, we end up in a place we don't want to be. So that would be one thing I would be adding. Another thing I would love to add as well is vitamin D. Yeah, to strengthen the bone. Because by the time a patient gets to the age of 30 years old, our bone is not growing anymore. Unfortunately, everyone in this room is over 30. So it's for our
I'm
children
16.
really and other
Kenny.
younger patients that are not 30 years old yet. So we need to add that to our diet, whether we are in a country where there's no sunshine, like in Ireland now it's always raining. And I don't know about Canada where Obi is. And from what I heard, Abby is in US. So I think US in some parts you can be so lucky with sunshine and all that. So adding vitamin D and calcium, I hear adding K2 as well help digest the vitamin D. So I will advise do your own research. But definitely for a sickle cell patient, one of the biggest complications is this bone issue in later life, where a lot of patients will go through joint replacement, whether in the hand, in the leg. It could be anywhere. Like I've been free from sickle cell in the last 7 years. But this is one of the things I'm still battling with, because a lot of wear and tear on the bone of having crisis for over 35 years, sometimes every month hospitalized, sometimes twice a month. So this happened to patients. So we need to look after our bone. Is really, really important, more than anyone else. So that would be the two things I'm adding. One came to my mind as well, but obviously I'm so concentrated trying to say everything I need to say. But definitely strengthening the bone will be a crucial thing a patient with sickle cell needs to look after. And also probiotic, because when a patient gets to an age where you get married and you want to have your own children, this will really play a key role in the type of how strong your child is going to be and how healthy your child is going to be, because your child is going to gain your own gut bacteria. You can imagine if you have been using Calvin pen penicillin all your life and you probably have a damaged gut, and your partner as well has a shaky gut as well due to other reasons, your child is going to inherit your gut bacteria from both partners. And this will determine how strong that child is going to be, how their immune system is going to be. So we can actually have a foundation for our own family in the future by taking care of our own gut right now. So that would be my advice to every carers. Make sure you are including vitamin D in the children's diet. Make sure you are adding probiotic. For some people living in outside this developed country, you can make your own probiotic locally. There's a lot of food that we just decommonize, but they are actually
Oh, that's so good. I
Yeah.
know my doctor told me to be taking vitamin D, just
Yes.
buy it across the counter and take it. I take it. I don't know why.
Yeah.
And maybe just to, I don't know if Kemi will be able to. Okay,
Okay, she's
she's
back.
here. She's back. Kemi, you're back. We can hear you.
I think it's just my network.
Yeah,
Yeah.
it's fine.
Perfect. So I'll just mention some few food, because some people might be hearing this for the first time and
Yes.
wonder what is probiotic. There's another thing called prebiotic. So
Okay.
prebiotic is what feed uh our good bacteria in the guts. So prebiotic is the food, while probiotic are the bacteria itself. So there is a lot of food we can include in our diet that we get all this good nutrition from the food. And even when we have a good gut bacteria, we can actually digest our food better and derive all the nutrition our food has to offer, because we are not digesting properly. You can eat the best food in this world, but your body is going to process it before your body actually absorb it. Absorbing is when your body takes on the nutrient and is able to benefit your body. So if your body is not going through all the proper process, then you are eating all this good food, but your body is not having any benefit from it. So I will just mention few food that we can all make ourselves or get locally wherever we are in the world. So one of it is yogurt, which is plain yogurt. And if you cannot get yogurt, like things like our cornmeal, like our ogi Nigeria, for those that comes from Africa, or the water from the ogi is full of probiotics. Things like soft cheese as well, like our wara in Nigeria as well, or wherever type of Africa country we come from, or wherever, we can get things like that.
Sorry,
Like
may I cut
onions
you a
now
bit? Sorry,
is very
sorry,
rich in
Kemi.
prebiotic.
Sorry. I want to be able to
Bumi,
recognize
you need to. Bumi,
Can
I
you hear
think.
me?
Bumi, you need to. I'm
1
going to
minute.
tell this. Bumi, you need to. You need to have a specific episode with Kemi on. Kemi is one of the best resources you can get when it
Right.
comes to nutritional advice for people living with sickle cell anemia. The condition brought us together, and she's a dear friend, and I've learned so much from her
Yeah.
as well. So
Thank you, Kemi.
trust me, Kemi you can't gain the benefit of Kemi by her just being here for 2 minutes. I think you better just
Okay.
I've given her to you. She
Well,
came on. Hey,
all
so
right.
you have
We
her
have to
now.
we'll have to get in touch. So
Yes.
before
Thank
you carry on with the names, Obi needs to go
Yeah.
because she needs to go very quickly. But I just wanted to have to say maybe a last word for maybe what is the hope message for patients out there? Just your last words on the episode, and we will come back
My,
again
okay.
with another
Thank you.
version.
So my hope message is this: we are here. We have the condition. We're living with it. It is our reality. Okay, but we can still flourish with it. We can still thrive with it. Okay. What you need to equip yourself with is the knowledge of what to do and how. All right. Do not let this condition limit you. The condition you have is not a limitation. It is like everything else that you have to live with. Even with sickle cell, you can be everything you want to be. I want you to step into the place of strength when it comes to your mindset. Do not let this condition limit you. Get the information you need, take good care of yourself, eat properly, but stay strong and foster good relationships. You need a community around you. Do not suffer alone. If you feel down, sometimes depressed, weighed down as a result of this condition, seek help. Get in touch with people. If you don't want to talk to people who know you, you can reach out to me. You can reach out to any of us, any of us, and have a conversation. Speak out when you need to talk to somebody, but do not put any limitation on yourself. You can thrive in spite of this condition. You can succeed in spite of this condition. Abby is here. You can see her. Kemi is here. You can see her. There is hope for you. It is not a death sentence. Parents, do not stigmatize your children. Do not hide them. Sickle cell is not a curse. Sickle cell is a blessing. I've dealt with it for over a decade. I know how hard it is. If you need support, if you feel down, reach out to somebody, talk to somebody, but you can do this. That's my final word.
Thank you very much. Thank you, thank you, thank you. We're blessed to have you. Thank you so much for sharing your experience. We really appreciate your time.
Thank
Well,
you.
I'm sure we'll have more questions and more a reason to come back on this show to say some some things and add our voices to what is happening in the world regarding SCA. So thank you very much, Obi, for your time. I really appreciate this.
Thank you for having me. Thanks,
Thank you.
ladies.
Thank you. So while we allow oh, okay. What did I? Okay. So, thank you very. Oh, where's
Please bring
Kenya's
Kemi
gone?
back.
Yeah, I don't know where she's gone. Okay, please, please come back. Yeah, please come back on. Tell us soft cheese, like you were saying. So, for those who are in the place where they can't get all these Oyinbo food, the local food, what are those local food you think people can, always get that we take for granted? What are those food that will benefit those suffering with sickle cell anemia? Yes, over to you, Kemi.
Yeah, definitely. Things like, yeah. So definitely things like green leafy veggies. We have it all around us, no matter where we live. In this part of the world, things like broccoli, Brussels sprouts, our spinach, we can all use it. We can add it to our smoothies. One of the ways I give it to my kids is I add it to smoothies. So by the time I add the spinach, I had a bit of yogurt, a bit of honey and orange juice. We've had amazing smoothie that is filling and is so full of the good stuff for our body, whether we have sickle cell or not. So things like that is amazing. Like I was saying, there is something called kimchi, and there is a drink called kifa as well. You can ferment that yourself. You just have to learn it and get a fresh milk. Usually I go to the farm here. I go to my local farm and I get it straight from the farmer, the milk, and I bring it home and I make my own yogurt. So for somebody who can't do that, wherever you are, there will be yogurt in the store. But if you don't have that, in our like I was saying, I don't know if you could hear me, things, even palm wine is good stuff, is full of probiotic because it's fermented. According that, okay, if you don't let it ferment for a long time, it's going to produce the alcohol. If you go beyond, I think 4 days or so, it's going to produce alcohol. So when it produces alcohol, then I will not advise you give it to your child or you take that as a sickle cell patient. But once it's fresh, you can take that. It's really good for you, you know, and especially after taking a course of antibiotics. Sometimes some of these
Oh, come on, internet. Come
That's
on.
very, very informational. Now I know why I take vitamin D. I didn't know before.
Then during COVID, it was like, oh, vitamin D, vitamin D. Everyone has to take vitamin D, because you're living in a country with this. So that was the reason we were given. But
Yeah, I know why I take it now.
well, before COVID. Okay, go on. Thank you. Go on,
Oh,
sister.
she's not coming up. What's your
She's
next
so
question?
yeah, I was saying that,
Oh,
yeah, like I know my network is not what I did, it's just the service generally. It's
yes,
been like that
yes.
for the last few days. So, and I didn't want to refuse the call.
Oh.
So I will just round up with what I was saying quickly so that the network stop throwing me out.
Don't
So
worry, we'll
anyway,
find
like I
another
was
time.
saying, a lot of patients take, yes. So a lot of patients takes this course of antibiotics for 7 days or even more, and that's just put our body under stress. It kills off our good gut bacteria, and then the doctors don't tell us to replace it. So these are the food we can include in our diet. Even things like zobo drink, beetroot is really good. You can research that yourself. It's really good in even replacing some of the good stuff a sickle cell patient need, and it will increase their iron naturally. I was interviewing a patient in South that lives in South Africa. She has a rare blood type that she can't even get blood transfusion. She's like 7 people in the country that can donate to her. So she went on these supplements, moringa, I was told,
Okay,
and
moringa, I've heard
beetroot.
that.
So she would juice the beetroot every morning. Yes, she would juice the beetroot every morning with ginger and lemon or something. And she drinks it every day. And this got her hemoglobin to 11. So when she told me that, I said, if your hemoglobin can get to 11 by yourself, you don't need a transplant. You are perfect. Because my blood was 6. My blood used to be 6. So if it drops beyond 6, my hemoglobin, then I need a blood transfusion. So
Wow.
there are a lot of natural things we can try that can really improve every day for a sickle cell patient and their family.
Wow.
Patient like sickle cell doesn't need to put our body in bondage. Even though sickle cell is powerful, we can't deny that. But we can actually be on the driver's seat of our life with what we eat, how we live, our lifestyle, knowing loving ourselves, knowing when to take a break. Sometimes we feel the pain is coming up and we say, let me just finish what I'm doing. You can't do that. You just have to stop it right there and there and know that sometimes when I was sickle cell, I know if I stand up from wherever I was sitting, because a crisis was coming up, if I just stand up, that would just kick start it. So I would just stay still and I would just tell my husband, please get my medicine. And I would use the biggest painkiller I can use and just stay still. Because I knew that if I move, that would trigger the crisis. So knowing ourselves, knowing the type of people to surround yourself with, especially people that will just sacrifice things for you, that love you genuinely. Those are the things a sickle cell patient need to do and know, and tell the people that need to know. You don't need to tell the whole world you are a sickle cell patient, but tell the people that need to know. For example, your housemates. You don't wait until you have crisis and then you're now guessing what is wrong with you. And then sickle cell crisis has taken your voice at that time. You can't even speak. You can't even explain what is going on. So those people need to be informed. They need to know what to do. They need to know where your medicines are. So they know what to do to help you. Because they want to help, but they don't know what to do. So it's when you are not in crisis, you need to educate them. So when you are in crisis, they know what to do and they can help you and support you the way you need at that moment. Let them know your doctor's number. Whoever they need to call that will get you the help you need. Those you have to communicate. And those are the people, your inner circle. Those are the people that need to know. Not anyone that just know and say, hey, yeah, and that's it. You don't need a yeah.
God
You
bless you
need
for that point,
practical
Kemi.
help.
What I
Practical
do
help.
is like when I
Yeah.
change jobs or on any job that I am, I tell my boss, my immediate boss, about sickle cell. You know why? Because at times I would like to go for my transfusion, like I explained, I would like to take extended hours off work at times, maybe for my blood transfusion. For somebody like me, I could have multiple doctor visits in a week, but that doesn't mean I'm not going to get my work done. I'm going to get my work done, but I have to see the doctor. You see what I'm saying? So thank you for bringing this point up. I have always made it a point of duty to tell my boss And my direct reports, people reporting to me when you want to reach me at certain time, and I'm like, I'm sorry, I'm not available now. Can you come late? So that they will understand. Actually, my current boss, she's super. I'm not sure whether she has somebody that has sickle cell or not. I'm not sure about it. But once I started to tell her about the condition, I wasn't telling her so that she can pity me or something. No, I was telling her so that she will understand my need for reasonable accommodation
Yeah.
on the job. She is super. She has cooperated with me. At times she will ask me, Abby, do you need to see the doctor now? She works with my schedule. And I don't take that for granted. Because at the end of the day, your job needs to be done, right? And your doctor's visit cannot be like at 6 p.m. It has to be during the day, right?
Yeah.
So when
Yeah.
I take 2 hours off work to see my doctor, then I know that I have to be disciplined and make it up when I come. Because I have also, in as much as I need them to understand my condition, to give me reasonable accommodation, I also have to do my work to gain their trust,
Mm.
to prove to them that although I have sickle cell, it is in no way going to limit me. I'm a high performer. Just give me a try. I'm a high performer. I will get the work done, but I need accommodation. So
Wow.
thank you, Kemi, for
Wow.
saying that.
The internet is playing up, but while she's trying to come up, are there careers or lifestyle patients need to avoid before we now go over to the hope message for the patient? So we just have
Okay.
two more. Are there
Okay.
career or lifestyles patients need to avoid?
Okay. Let me talk about lifestyle first. We talked about choice of where you can live, avoid areas that have high altitude
Yeah.
because of the oxygen, stuff like that. Avoid very cold places, extreme, not just very cold places, very hot places also.
Hmm.
Extreme weather condition triggers crisis, extreme. So those are choices, right? And what your nutrition, like Kemi advised us. I took a lot of notes when Kemi was talking. You know, I like information. I thought I was well informed, but you learn every day. So I learned something today. And um, yeah, so those are lifestyle, right? Now, when it comes to choice of career, anybody listening to this, please, I'm not in any way limiting people with sickle cell. I am a sickle cell warrior myself, and God has blessed me with good life and long life. God has blessed me. So, with my experience, this is what I can say. We have talked earlier on that we don't have that stamina like regular people, right? So, in the choice of career, I would say please consider jobs that require energy. You understand? Look at those jobs and like kind of like, push them aside, like if you have a job that you have to stand somewhere for like 13 hours stretch, you have sickle cell.
Mm.
Most times you'll be calling out sick, or most times they have to call 911 for you while you are standing on that job. So I'm not in any way limiting what you can do. I am not, because I don't like it when people place barriers on me. If you place a barrier on me that I'm not going to be able to do something, I'm going to prove you wrong. I'm going to do it. But this is how we're talking about how to enjoy life with sickle cell.
Mm.
Avoid careers that are high energy, that demand high energy. You can go into careers like that, just like desk jobs, like somebody that did not have a university degree was asking me, choice of job. She gave me like three options. And I'm like, oh my God, the customer care, I would definitely do the customer care. Because of all the options, the customer care was Death's job. And with the customer care, she could work from home. I'm like, why not? It's a no-brainer. Then she said, oh, I like to interact with people. I like to talk to people a lot, to be on my feet. I'm like, you're going to increase your chances of, you probably increase your chances of having crisis. So when you have customer service job, you can also interact with people when you go to the office. But when you need accommodation to work from home, that is not going to be a problem because you can do that job also from home. So that is the way I reason personally. Anything that demands high energy, I tend to put them behind, and careers that would give me accommodation that are flexible, like during the corona crisis, some people could work from home, some people could not, just because of, you understand what I'm saying? So when I normally tell the people that I mentor career, career. I once had a male child. He wanted to go into swimming, compete at the Olympics level. I had to tell him, I said, I don't know about you, but swimming takes a lot of energy. The few times I have tried it, I ended up in the emergency room. I'm not saying don't swim. I'm not in any way limiting your dreams, but you have to make that choice from an informed position. You have to know what you're getting into. It takes a lot of energy. And I always have this energy talk with my male mentees. They want to be in the gym 24/7. They want to do this. They want to do. Of course, Bubi, if you remember in Akure, then in
Oh.
high school, I used to march. I tried doing track. I did track. I ran in the inter-house sports, 400, 400 meters. I marched for the school, for my house. I tried it all. You just want to try it all, because the one day of good health that you have, you want to do everything. What you have not done in 10 years. So I tried it all. But I was also aware of the consequences or the results of what I was getting myself into. So when we talk about career choices, lifetime, we want to have good quality of life. Let's think about that. I personally would shy away from any career that will require high energy. I'll shy away from it personally.
Thank you. Thank you very much. How about you, Kemi? What do you think? The question is, are there careers or lifestyle patients need
Yeah,
to
I
avoid?
think Habi said all the right things. I can't hear your question properly, but I believe I'm still answering the right career for sickle cell patients. Is that it?
Yes.
Yeah.
Yes.
Yes.
So my little contribution with that would be love yourself. Be deliberate about loving yourself. If you love yourself, you won't do things that will put your body into stress to the point that you are getting into crisis. I would say if you have love for strenuous activity and all that, or be the brain behind it and let others do the physical part. You can still be everything you want to be. You can still be everything without anything less, but use common sense. That would be my simple advice. Be the brain. One thing I've seen with sickle cell patients is each sickle cell patient have their own inner gift. They have a gift that nobody else have. I'm telling you, for every sickle cell patient, if you look within, there's something you can do better than other people. Why not concentrate on your strength instead of working yourself out on your weakness? Find out where you are good at, what you can do that makes you shine. Concentrate on that, and every other thing, let somebody else do that. Learn to delegate. If you are a boss, don't be the one standing up in everybody's face. Delegate the physical parts, and you do the brainstorming part. And do for, like, I've interviewed other self-employed entrepreneur. They are just on their own, they do their own business. And I asked, how do you manage when you've got a job? And for example, now I have a friend who does photography. He's a sickle cell warrior, and he does wedding events and all that. And how do you manage
Okay.
That's interesting.
Yeah. I was just about asking her the question, what does it mean to be free from sickle cell for 7 years?
Oh my
Years?
God.
Does it mean having a crisis or the blood genotype has changed? So sorry, I was just saying, I know you said, in summary, avoid energy, just like Abby said, avoiding energy sapping activities. I was, I wanted to ask, you said that you've been this is your 7th year of freedom from sickle cell. What does that mean? Does it mean you don't have crisis, or is it that the genotype has changed? What does that really mean to those who are listening and coming in for the first time on this show? Yes, Kemi.
Yeah, I will just answer that. I'll answer that briefly, because I've downloaded all the story in my book,
Wow. Please show us
named
the book.
One Day at a Time, a sickle cell survivor story.
Okay.
It's on it's on Amazon. Can you see it?
Yeah, I'm trying to bring it
Yes,
up.
I see
So
it.
it's a
Um,
very small
what's the
book,
name of the?
One day
but
at a
it
time.
has there's no it's One Day at a Time
Okay.
by Kemi Tijani. If you type that on Amazon, you'll find it. It's a sickle cell survivor story.
Okay. Yeah, found it.
I loaded the information there.
Wow.
And one thing you asked that I can just tell you straight away is, yeah, this is my 7th year of being free from sickle cell crisis. Like I said before, for me, yeah, that's the book. Sickle cell for me is an invisible enemy.
Hmm.
Sickle cell hated me. Some people are lucky with sickle cell, they only get it maybe once in a while. Some you can even see them, you don't even know they have sickle cell. In my own case, I had pain every day. So the one I tag crisis is the one I couldn't manage by myself at home. That the pain was so much that I had to go seek for help and go
Hmm.
into hospital. So that's the one I called crisis. So the one I have every day and I manage,
Hmm.
I don't call that one crisis at all. So my prayer in the morning is always, God, give me the grace to live the whole day, take care of my husband, take care of my children, and not get to hospital. I don't want to call ambulance today.
Hmm.
That's my prayer every day. And every day I get through my day without pain, with painful crisis that send me out of my house to go seek for help. Then that day is done. And then we look forward to another day. So I take it one day at a time. I think that's where that title came from. And for me, it's not about thinking what the future is going to be like. I'll just take one day and enjoy, live that day to the fullest.
Hmm.
If I survive this day, if I have grace to live the next day, I'm fine. Let me just take it bit by bit. No, I wasn't biting more than I could chew.
Hmm.
I just took it bit by bit. And here I am today. It was a long process. It wasn't easy. There was a lot of hurdles on the way. But that's why we need to renew our mind, knowing that we can make it no matter what. Yes, we have sickle cell, but we can make it. We can live our life to the fullest. Knowing that, I tell myself and I tell my kids, you are made for more.
Mm.
Sickle cell doesn't just define who you are. You are more than that. Sickle cell is just a condition you have to live with. Everybody else live with a condition, one way or the other, whether they know it or they don't even know it yet.
Mm.
But the good thing is, you know what you are fighting. You know the enemy confronting you face to face. And then it's just knowing how to manage it. So I've written the secrets, how I got the treatment, where to access it. Everything is in the book. And also these complications I experienced that nearly sent me to early grave.
Mm.
My complication was different. I heard Obi talk about stroke and other things that Abby talk about as well. I didn't experience stroke, thank God, but I experienced something completely different.
Mm.
That
We'll
could
see it in the book.
potentially, yeah,
We'll see it
yeah,
in the book.
that is
So,
sickle cell.
everyone listening, get the
Yeah,
book, and get all the full download of um Kemi's experience. Thank you. Bef- while we're rounding up, because I know Abby has been sitting for 2 hours, 15 minutes, and I don't want to stress you. From what we've said today, I feel like coming to hug you and be like, oh, you've
oh,
gone through a lot and all that, but I can't. My arms are not stretched to the US, from UK to the US and to Ireland. Thank you very much for sharing your story with us, Kemi. Oh, I can't. And then Obi in absentia, thank you, thank you, thank you.
yeah.
But like you were saying, you were given the message of hope. I want your final words on this show about a message of hope for those suffering with the disease. Can you please dish out your hearts to them in a few minutes while we round up the session? Thank you. Over to you, Abby or Kemi, whoever wants to start first.
Okay, I can go first. um, Let me start from stress. When you were talking about the triggers, right? Obi mentioned stress. That is real. For me, when I want to take an exam, I am stressed. Most times, I end up in the hospital. There was a certification I took recently, about 3 years ago. I needed it. I felt I needed it because I felt that was the future of my career. So I quickly jumped on the bandwagon and took the certification. Just grab it now. We went to a boot camp and everything. In that boot camp, I had crisis. And at the end of every day, we will take the exam. It's 4 stages. So I passed the first one and the last one, and I missed the middle 2. So I had to come home and take it again. You would think that because I'm in my house, I should get better and do better. I got worse, actually. And I cried so bad because this is what sickle cell does to me. When I was every exam that I've taken, I had always had crisis because it was stressful, right? The physical stress, the emotional stress, and everything. And I felt like my mates will go before me, and I have to be. I'm sorry, I'm emotional. That I had to be trailing them behind. And something in my heart wanted to fight that so hard. Something inside of me wanted to prove to the whole world that I'm valid. I can do it. And it brings on more stress upon stress. So, having mentioned that, I just want to encourage every warrior out there and every caregiver, even going into marriage. On my wedding day, I had crisis. Going into marriage, the thought of giving birth, is a joyful thing, right? But with sickle cell, for us, is a double-edged sword. That process is a real reality that death could take you in that process. So it's a double-edged sword, and I'm a warrior. I survived it. So my message of hope is that every stage in life, it comes with its own stress. You might think that, oh, am I going to make it? Just the mental stress of thinking how you're going to cope and everything. It could trigger a crisis, right? Sickle cell is a condition that we live in. Although it could tend to limit us in some areas, but we can overcome it. We can overcome that the troubles that come with the disease if we know ourselves. And with sickle cell, you can be whoever you want to be. You can be whoever you want to be. Like Kemi said, let us learn to take one day at a time. That is actually how I have learned to enjoy myself. I take life one day at a time. I like to be happy. I like to make people around me happy. I actually love to cook. That is my hobby, you know. Because cooking is my hobby, I have found ways of cooking smart. You see, like instead of checking on the meat every 5 minutes, I just have ways of cooking smart. I buy smart gadgets, I'm writing a recipe book. I do things that just bring me joy. You understand? Like Kemi said, and Obi, I think it was Obi that mentioned it, that people with sickle cell, we just have this special thing inside of us. I think the sickness kind of developed this strong survival instinct inside of us. Like we know they carry last, we know go gree. That disease can do whatever it wants to do. That's the problem of the disease. We know go gree. And Kemi said, telling the people that need to know. That's very important. They're going to give you necessary and reasonable accommodations. Those accommodations are necessary to get to your goals. I personally, there's no competition in this life. One day at a time, enjoy life as it comes. If crisis comes, I take it. That's another bad day. I take it like that. Any day I'm healthy, I'm happy. I want to cook. I want people to come over to my house to enjoy my creations in the kitchen. I do things that just make me happy. So I want to encourage everyone with sickle cell, every warrior out there. Look, I'm 40. I'm going to be 48 years old in a couple of months. I have a very good husband. I have two wonderful children. I come from a very good home. My parents, God bless their soul, they have tried for me. I see people that surround me, that they love me genuinely. I have friends that are closer than my brothers or my sisters, And I try to give back that energy, that good energy. I try to give it back. Actually, giving back good energy makes you happy. That's another thing I've realized, Put a smile on somebody's face, you're going to be happy. There's something I do in church. One day my pastor called me, how are you making money from this thing? I'm like, no, I'm not making money. He said, so how are you getting satisfaction? I said, seeing somebody else, working on my advice, and they are thriving, it makes me happy. He said, hey, okay, good, God bless you. He gave me his blessing on that. And that is, find happiness for yourself. Happiness is free, but you're not going to be limited. You know what? In Nigeria, as hard as it was going through boarding school and everything, once I chose my career, I knew I wanted to be an accountant. I knew that I needed to be a chartered accountant. With all the 2-year delay in school, our time, we had 2 years in college delay and everything. If college was not delayed, I would have been a chartered accountant at 24. But college was delayed for 2 years. And with all my sickness, all the struggles, everything, I was one at 26. The accounting thing, we were sleeping there, studying in that school, right? mosquitoes, with a lot of things. But guess what? I was determined that this I can. If I pass it and I die, on my grave they will say chartered accountant. They'll say sickle cell killed her, but she was a chartered accountant. That was my determination, and I got it. So, a word of encouragement: you can be whatever you want to be. Sickle cell can postpone the journey, but it cannot take it away from you.
Yeah.
The only thing that can take it away from you is you. So please, in order to get to that place of happiness, to enjoy life, please take care of yourself. See your hematologist regularly. In my own case, I have a pain management specialist that coordinates all my medication. My most valuable possession, you can't even guess, is my electric blanket. I have it scattered everywhere in my house. There's one in my living room that is my happy place. Once I crawl on my couch and I just put it on to power 8, I'm happy. I'm watching TV, doing everything. I'm just cozy like that. I'm happy. So I have tried to find my own happy place. Please get what makes you happy. Know your choice, of where you want to live, your choice of career, your choice of dieting, and above all, please pray. Because no matter what we do, no matter what we know, whatever happens, we need a supernatural direction. We need direction that is not from man. We need to put our trust in God. The Bible says this. The Bible says, I wish above all things that you prosper in health, right? Even as your soul prospers. We can do this, warriors. We can live old. We can enjoy life. We can be married and have children and, just live well. But let us be informed. Thank you very much.
Thank you. Thank you very much. Over to you, Kemi.
Wow, 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 wow. What can I say after that? That is so amazing. So I will just add few things is know when to be quiet and know when to talk. So this is from experience really, because a sickle cell patients, we visit a lot of doctors in their lifetime. Doctors are not always right. Even though they are the professionals, they don't know your body as you know your body. I remember when I was misdiagnosed for cancer, they kept telling me, you got to start chemotherapy and radiation. And I said to myself, I don't feel different in my body. And I insisted that I wasn't going to start any treatment unless they can find the source of the cancer. We did 2 different biopsies. At the end of the day, we had to do an open surgery that wasn't necessary. And from that experience, I know that I have to be in charge. Even though I'm not a doctor, I have common sense. Don't just follow what everybody says. And to the point that you don't know the left from your right in the name of somebody is a professional. As a sickle cell patient or any patient out there, I would say empower yourself with knowledge. Have wisdom. If the doctors come talking and they use their big doctor grammar and English, you tell them, please, can you speak layman English? Because when you understand what they are saying, you can ask the right questions.
That's true.
That would be my main advice tonight. If they tell you something, take Google. We have Google now. Everybody can have access to it. Read it. Ask questions. Ask people that have gone before you. And don't be quiet. Be your own doctor. Know what you're doing. Have common sense. And let God lead you. Just like my sister ended with the word of God. Let God lead you. God actually wants to help you. Allow him to help you. And like my sister said, she said, have the right career, create your own happiness. My own version will be, don't compare yourself to others. Know your strength. Know your limit. If everybody is saying they are going to the gym, 1st of January, everybody is registering. You know you don't really belong there. Gentle work is enough for you. A gentle work is enough for you. If your friends are saying they are going to walk 10,000 miles, they are challenging themselves, you know you don't belong there. You won't be part. Just sit down on one bench and be clapping for them. Clap for them, cheer them up. In what I'm saying in a nutshell is know your limit. Love yourself enough to know when to say no, when to say yes. Don't be a people pleaser. People pleaser will put you in big trouble. Know your strengths. I can't overemphasize that. And your medications. Don't wait until you have crisis till you start taking your medication. Medicines are miracles from God. If you take something and it works for you, it's a miracle. Because once you take it in your mouth, you have no idea which direction is going in your body. So if the medicine goes to the right place and does the job, it's a miracle. So don't wait until the pain now gets to a point where you can't talk anymore. That's when you are taking your medicine. Take your medicine. Put it around you. Don't wait until it's finished before you feel it again. Take care of yourself. That is you loving yourself. And anything that will cause you stress, stay away from it. If it's a friend that is causing you stress, stay away. Stay away. Love yourself enough to say no and to say yes. And like I said, sickle cell doesn't define you. Sickle cell is not who you are. That's not all that is about you. There is more inside of you. You have more strength that you can even think of, that you can even imagine. You just have to find out what your strengths are and capitalize on it. Don't compare yourself to anyone. There's no one in your own race. You are the chairman of your life. Yeah, you have God as your creator, as your everything. But then don't be a people's pleaser and a people follower. For a sickle cell patient, it doesn't work. Be yourself always. Be yourself. Know your strengths. Be intentional about loving yourself. And capitalize on your strengths. Play on your own strengths. You can achieve whatever you have to achieve, but know the area where you have to focus. Don't focus on other people's focus. If that makes sense. Focus on your own focus. I don't know. I came up with that last week. Focus on your focus, and I've just said that everywhere.
We get it. We get it.
Exactly. Like know when to just drop everything if you have to and take a break. Break is very important. Don't say, let me just do 5 minutes more. That 5 minutes more may cost you 5 days that you can't even stand up and you are crying in agony. You know? So that would be my advice. Love yourself is very important. Surround yourself with the right people. People that will drop things for your sake. People that love you to that point that if they even hear your voice, they understand what to do. You don't need to be explaining. Those are the people you need to surround yourself with. Tell the right person about your condition. Nobody has to know. If the right people know, you are good. Tell who needs to know. Only who needs to know. If they don't need to know, if they just have to say, hey, yeah, sorry, hey, pele. What does that do? It doesn't do anything for you. You just throw a pity party. What do you gain after that, Pele? No, nothing. And be strong. Be strong in the Lord. The Bible says, and it's my favorite verse of the Bible, the plans I have for you, says the Lord, is better than any other plan you can ever have for yourself. No matter where you find yourself, and you think, oh, the whole world is on your shoulder, there is always a way out. If you just look long enough, if you just wait long enough, there is always a way out. My prayer point all my life is, God, take this pain away. Take this, even though I don't know how, but eventually God made a way. No matter what, God has a plan for you. And the plan is to prosper you and not to harm you, to give you a hope and a future. You have a future. You have hope. Don't feel as if you are a victim just because you have a condition. You are stronger than you think. And just take it one day at a time. Don't overdo it. One day at a time. Yeah. I'll
Wow.
just leave it at that.
Loaded. On this note, I just can only say thank you for coming. Thank you for jumping in at such a very short, in fact,
All in
impromptu.
payment.
Impromptu. Thank you. It's a blessing, and we'll talk after this later. So you've been on your seat for 2 hours, and I don't want to contribute to stressing you out. Please, thank you so much. I really appreciate it. I really appreciate it. And I'm sure our viewers out there, you've got questions, you've got someone suffering, and you need advice. These are the people to talk to. You can send a comment and they'll pick it up from there. Thank you very much for throwing more light, for adding value to the lives of people who are listening to this. Thank you so much. I can't thank you enough. And so I will say to everyone out there, thank you very much for listening. And if you want to just share the video, subscribe, send to people, and look at the comments that have been written there. Listen and listen again if you need to, so that we can all be in a supportive group of people who are suffering with sickle cell. Not just the bit, but the doing, helping out. If it takes you to help them drop their kids at school because they can't get up from bed, or whatever little things we can do, not just about, oh, I have my own life to live. These people need your support, need our support, and we all need to be there for ourselves, because they are even stronger than some of us who are. So why not help them, and they will help you too, in terms of making the life go on. So I won't say much. They've said it all. Thank you very much for coming to the show.
Thank you for having us.
Thank you.
Thank you so much.
Thank
And
you.
Kemi, nice meeting you.
Nice to meet you too. I'd like to know more about you.
Thank
Anyway,
you.
Okay, let me go to your Facebook page. So maybe if I can just on Facebook, let me see. That's the final bit now.
Probably
The
won't see
name
on Facebook.
is you.
So if you
Yeah,
want to find me, I'm on Instagram. So
Oh, you're on Instagram.
Kemi
Yeah.
Tom. Kemi Tom 2002. You'll find me there.
Kemi what?
Kemi Tom. So it's KEMI. Let me see if I can type it in.
Are we still live?
Yeah, we're still live though. We're still live.
We'll share that information later.
Okay. All right, then that's fine. So yeah, thank you very much for watching, and see you next time with another episode. Maybe this time nutrition. Talking more about the nutrition, I think it would really help to take it further.
Yeah, nutrition is fine. Mm-hmm.
Yes. So thank you everyone, and bye-bye.